Get it started.
Good afternoon, everyone, and welcome to Health Center 3 Annex Walk-in Vaccination Clinic. We are excited to have you here with us today to join in our commitment to provide vaccinations to our most vulnerable Philadelphians ages 65 years and older. This initiative could not be possible without the leadership of ambulatory health services. As such, I would like to give a thank you to Cheryl Kramer, Executive Director, Drs. James Dean and Yelena Galkin, Kelly West, Administrative Officer, Sharna Blake, COVID Vaccination Healthcare Coordinator, and Yvette Mentor, Director of Nursing. I would like to also give a special thanks to Health Center 3 staff who works tirelessly to provide services to our community on a day-to-day basis. At this time, I'm going to turn the mic over to Health Center 3 Clinical Director, Dr. Lena Vatican. Thank you for joining us today.
Thank you, Councilwoman Gauthier, the press, and all our staff for making this vaccine rollout a success. We are honored to be able to take care of our high-risk community by offering a walk-in clinic every Wednesday for people over the age of 65. The risk of serious illness from COVID increases with age. This is why the CDC recommends that people over the age of 65 be the first group to receive the vaccine. The vaccine prevents serious illness and death from COVID. Studies have shown that the Pfizer and Moderna vaccine are safe and effective. Side effects from the vaccine are usually mild and compared to the serious COVID illness. People who have been vaccinated can start to do some of the things that they had stopped doing before the pandemic. For example, you can gather indoors without masks with people who have been vaccinated. If you travel, you do not have to quarantine afterwards. Getting vaccinated will also protect the people around you. You should still take precautions like wearing a mask, stay 6 feet apart from others, and avoid crowds and poorly ventilated spaces. People are considered fully vaccinated about 2 weeks after their second dose. For those who have had the vaccine, please encourage your family, friends, and relatives to come in. Share your positive experiences. For those who are still unsure, please reach out to your primary care physicians to discuss your concerns. In our clinic population, about 50% of the 65 and older have been vaccinated, and we are vaccinating more patients every day. In the walk-in clinic on Wednesdays, we are vaccinating with the Moderna vaccine. I would now like to introduce Yvette Mentor, Director of Nursing for Ambulatory Health Services of the Division of Philadelphia Public Health.
Hello, good afternoon, everyone. I'm here to just discuss with you a little bit about our process that we have at the health centers. We try to make this as seamless as effort for the 65 and older. All they need to do is just come in with their actual identification and register at the front desk, and then the nurses will take them back. They will explain everything that needs to be done. We also give them second appointments to come back on the second appointment. And in the process of that, when it gets near time, we usually give a phone call to those who need it to be able to come back on time. So that's a seamless effort throughout our city health centers that's doing our WalkUp Wednesdays. And that's what we like to do for all our patients and residents in the city of Philadelphia. Thank you.
Thank you very much, Yvette. I'll introduce Councilmember Gauthier.
Good afternoon, everyone. My name is Councilmember Jamie Gauthier, and I represent Philadelphia's 3rd District, which includes much of West and Southwest Philadelphia. I am so excited to see this effort to vaccinate our most vulnerable populations here in West Philly. And I'm so grateful to Mayor Kenny, Commissioner Farley, and the Health Department for recognizing the urgency of creating walk-up vaccine access right here in our community. I'd also like to thank Vanessa Johnson, Dr. Lena Vadikev, and all of the staff here at Health Center 3. For all of the work that you do day in and day out to keep our residents healthy and safe. The importance of public health has taken center stage since COVID arrived in our city last year, and the value of our frontline healthcare workers can't be overstated. So thank you so much for everything that you do. Like cities across the country, Philadelphia has been rocked by the COVID-19 pandemic. And also, like cities around the country, Philadelphia's Black and brown neighborhoods are bearing a disproportionate burden when it comes to this virus. Infection rates here have been highest in communities where the majority of residents are people of color, communities like ours. People of color have been hospitalized at higher rates than the general population, and they have lost their lives to this disease disproportionately as well. This impact that COVID is having in our communities is a direct result of the structural racism that's baked into our country's institutions, and it has been for generations. And that's why it's so important that we do everything within our power as a city to fight against these forces and to make equity the driving factor in all of our efforts. And walk-up clinics like the one happening here today are a major part of achieving that equity. All Philadelphians aged 65 and up can come to this health center on Wednesdays and get vaccinated then and there, and it's that easy. The walk-up vaccine access is an important step towards finally getting towards the light at the end of the tunnel that is the end of this pandemic. And I think I can speak for all West and Southwest Philly residents when I say we're excited about being one step closer towards getting back to the rhythms of daily life that we're accustomed to. I know how hard the health department has been working to get vaccination sites up and running, and I look forward to continuing to support their work to increase vaccine access even further here in the 3rd District. Thank you so much.
Thank you very much, Councilwoman. Any questions from the press? Oh, you guys are easy. Can we do this, carry this over until Tuesday? Well, thank you all very much for coming out. I appreciate that. We are going to try to see if we can get you into a clinic room with somebody getting vaccinated. No promises yet, though. And thank you all very much to the speakers and everyone else who was assembled today. This was wonderful.
Thank you.
Thank you.